System 1 always works on the opposite side. Opposite side, always. As in Neijing says, needle as far as you can on the opposite side. So we have to do the same. Imagine the pain on Xiaoyang, sciatica, along the gallbladder, coming from the gallbladder 30, going all the way down to the fourth toe. How to balance it, how to treat it. Dr. Tan always asks, how do we do acupuncture? 1, 2, 3. So, what is the sick meridian? Is the gallbladder. What is step number 2? Identify the balancing meridian according to system 1, for example, because we know system 1. Who will balance gallbladder? Senjiao. So we must apply image or mirror. Now we're dealing with 2 limbs, leg and arm. What we're going to apply, image or mirror? Mirror. We'll mirror leg into arm. So is it going to be direct mirror or reverse mirror? I believe this is a direct mirror. So we can needle the arm exactly from Jingwell point on Senjiao up to the very top. We can do that, but I will tell you now that the whole leg can be represented by the segment from the tip of the fingers to the elbow. If we project the lower leg to the arm, so we'll needle the lower segment of the arm on Senjiao meridian. But if we project the upper leg on the reverse image, we will needle exactly the same area, the lower arm. So the lower arm will cover the lower leg and the upper leg, both. So in balance method, we needle the lower segment only to cover the whole limb. That's why antique points were so popular in ancient China, because they cover the whole body. Later we will see that this segment will cover really the whole body, including the head, the torso, and the legs. So let's carry on. Pericardia and liver represent Zhu Yin. And according to system 1, all diseases on pericardial meridian will be balanced by liver, and liver will be balanced by pericardium. Let's say we have any pains somewhere in the ankle. So if the pain is in the ankle and exactly on the liver meridian, according to the rule 1, 2, 3, after finding the balancing meridian, which is the pericardium, according to system 1, we must find the points. If we apply the mirror, which point will represent or balance lever 4 in the ankle? Pericardium 7, exactly, because wrist represent ankle, and this is the bend, and this is the bend. The joint to the joint. The pain will go away. Let's carry on. Which meridians represent fire? Definitely heart and small intestine. And what about water? Yes, bladder and kidney. According to system 1, small intestine will balance bladder, or hand taiyang will balance foot taiyang, and foot taiyang will balance head taiyang.
So where is the pain?
Right where Alex has his finger.
How bad is your pain now?
Because I've been kind of digging into it, so I would say it's probably about 6.
Okay, pain is on the right hand side. We needle Tai Yang on the opposite side. Anything that's sore here? More sensitive, not sore, but more tender.
That's tender.
How is your pain now?
I'd have to kind of press on it, but
Press on it. Where is your pain? Where is your pain?
that is, I'm sorry, this is really freaky.
I taught my old friend balance method on Skype. He called me over the phone the same evening and he said, okay, look, I just learned the system 1, but I would like to apply it. His patient had pain on the scapula for 2 or 3 years, quite severe pain, and nothing worked. The friend was homeopath. So he wanted to apply the balance method, and he did. He started searching the bladder meridian. He only knew the system 1 on the opposite side, because small intestine will be on the scapula. So the hand taiyang will be balanced by foot taiyang. Which part will represent the scapula according to the image? Look, this is the head, this is the neck, this is the shoulder, and this is the scapula. So points below bladder 59 to 58 will represent the scapula. And he started looking for Ashi points. Where? On small intestine? No, on the balancing meridian, and he couldn't find Ashi points. But by pressing, he found some kind of lumps, and he needled the lumps on the bladder meridian. The pain went away immediately. So usually in 95% you will find Ashi points, but sometimes it can be something either numb or tough or stiff. Don't worry, needle. This is the Ashi point. Some people don't have Ashi points at all. They just don't feel anything. They don't feel pain. They have no sensations. Sometimes I insert 5 needles in the same place at the same time. They possibly would feel only nails. By the way, do you know why in some books it is prohibited to needle certain points? Very easy. In ancient China, the needles were very thick. They were slightly thinner than a nail. So imagine some points, some sensitive points, especially on the heart meridian, under the armpit crease, and others, they can damage the artery. Doing acupuncture with the needles that produced now with high technology, they are so thin they will not damage anything. So don't worry about needling any points. It doesn't matter. You can't damage literally anything. So let's carry on.